Hello, and welcome to our webinar on accreditation loss. My name is Sana Lynn Wrigley, and I am the Chief Operating Officer of Integral Healthcare Solutions. That we're having this webinar, and so grateful that all of you have taken the time in your day to come join us. A couple of notes before we get started. You will notice at the right of your screen there's a chat window. Feel free to communicate during the event. Put comments, put questions. I'll be putting some notes in there of things our experts are saying as we go through. Down at the bottom of your screen, you'll see a link that says Ask a Question. If you click on that, there are questions in there that we've put in from registration forms. You can vote for those to be answered or add your own questions as we go along. Just to the right of that, you'll see polls. Vote. Let us know what you're thinking, where you're at. We'd love to see your answers to those questions. So without further ado, I will go ahead and introduce our panel today. To start us off, we have Thomas Goddard.
Hi. My name's Tom Goddard. Go ahead, Sana.
Tom is our CEO and runs the whole show. Tom, tell us a little bit about yourself.
I got involved with URAC 20 years ago. I joined URAC as the Chief Operating Officer and General Counsel. And in addition to those responsibilities, also served as a reviewer on Health Plan and Health Network at first, and then website, and then others along over the years. And I founded this company, Integral Healthcare Solutions, in 2002. And we've been working with URAC and other accreditation organizations ever since then, mainly working with organizations seeking accreditation from URAC. By training, I'm a lawyer and an industrial organizational psychologist, and I live in sunny Tucson.
Thank you, Tom. Next up, we have Lesley Malus Reed, Company President for IHS. Lesley, introduce yourself.
Hi, good afternoon, everybody. I started in the Canadian healthcare system, and I joined URAC in 1997 and helped develop a lot of the credentialing network health plan standards. And I've been helping applicants get ready for accreditation here at IHS since 2003. That's when I joined Tom to do that, after we'd been on the road for many years as reviewers together.
Awesome, thank you. And last but certainly not DeMarino, former Vice President of URAC and our Chief Clinical Officer.
Hi, everyone. As Sana has indicated, I was at URAC for 17 years, started in 1999 as their primary case management reviewer, and through the years had many positions. I left there approximately 3 years ago and joined Tom and Lesley and the gang at IHS. And my background is I'm a registered nurse. I have a master's in healthcare administration, and I'm really excited to be here today.
Thank you, Sue. So why a webinar on accreditation loss, Tom?
Well, what we've noticed is, because all of us have been involved with this URAC process for 20 years on both sides as reviewers and as consultants to applicants. And what we've noticed in the last handful of years is a sharp increase in the number of organizations, accredited organizations, that are denied accreditation, either denied in the reaccreditation process or have lost accreditation in the middle of their 3-year span. And there are some key reasons that we're going to talk about in a bit about why that is happening. But you know, when we were young reviewers 20 years ago, we would almost never see a denial or any sort of revocation. But now we're seeing a lot more, and we're being contacted a lot more by organizations who were accredited under one version and submitted largely the same documents and came back and got a denial, or got a midterm review by URAC that caused them to lose their accreditation. And so this is kind of new, and we thought it was worth talking about today.
Thank you. So we've gathered up 5 of the major reasons that we've been seeing lately for accreditation loss, and we're going to go through them one at a time. So the first reason is failure of data integrity. Tom, Lesley, Sue, who wants to start?
Well, Sue and I worked on a client that, without getting into the details of the client, URAC was under the impression that a record could be changed that should not be changed, and it was a medical management kind of organization, and so that's one kind of data integrity problem that we've seen. If you've got if you're supposed to have only, in this case, if you're supposed to have only clinicians writing up their decision and their reasons for their decision, having the possibility that non-clinicians might be able to go back in and edit, or non-physicians might be able to go back in and edit those comments, was one version of that. Data integrity failures can come in a lot of different forms, and that's one we've seen.
Anything to add, Lesley, Sue?
No, I don't have anything else to add. Possibly just making sure that you have the protocols in place to ensure that data integrity is being monitored, looking at who has access to which records, who can make changes to them, is one of the key components that will keep you on the right side of the compliance issue.
And I think the obvious thing also is if you're going to update and change your systems, you still want to take it through an audit and a test to make sure it can meet all of the standards. And if you're unsure about that, you could always send in an inquiry to URAC to ask them whether it's still meeting it, or contact your consultant to work it out with them as well. It's always a good idea to do a little file review of yourselves every now and then, just to make sure you are checking all of those requirements to make sure that you're still in compliance.
It's important to know that URAC thinks about data integrity not necessarily the way a lot of IT professionals I've talked to over the years think about that phrase. It's very specifically accuracy and traceability. And traceability can often be an issue. If you can't tell who has touched in your database and when they touched it, that can be a problem.
Thank you, Tom. Our next major reason we are seeing for accreditation loss is that somebody inadvertently changed a process such that it was out of compliance with a mandatory standard. Tom's smiling and nodding. Lesley looks like she wants to start us off. Go for it.
This one. So there's so many reasons why this happens. Sometimes you might be going for a dual accreditation. Sometimes you might have turnover, and you are improving your policies and procedures, and it just takes you off the rails for what the standard was. There's a third reason too, a standard that you have been going for through 3 different accreditations. Core 3.0, you might have gone through 3, you're getting ready to do it for the 3rd time now. And although the standard hasn't changed, the interpretation of the standard may have been tweaked. So you want to make sure that you are constantly ensuring in your annual review, which is required in your Core 3 standard, your annual review of your policy procedures, that you're still not only complying on paper, but you're implementing it as well. With staff turnover, sometimes that goes off the rails. With trying to go for another accreditation or another module, it also can take you completely off the rails. You will change everything and then scramble again when it's time to go for the next accreditation to get back in line.
And I will tell you from my experience, sometimes you see new leadership that will come in. It goes to Lesley's idea about staff turnover. Well, it goes a little further as well, because if you have leadership that doesn't understand the standards and they see that from a budgetary perspective that it's not making sense, sometimes you'll see some tweaking of the resources that are available to stay into compliance. Or they may request changes just because it's not the way they're used to doing things as a leader. So making sure that you have that open communication with your leaders, having subject matter experts who can go to those leaders and say, yes, I understand. However, are you aware that we are accredited and that one of our mandatory standards is having a quality committee? Typically, I see quality initiatives lost first when there are budgetary constraints. So, and there are so many standards related to quality, you want to not give up your quality program if you need to make cuts to your programs.
Almost any sort of stochastic change or dramatic event in your organization's history can throw you off track. I mean, let's imagine that you had one line of business that wasn't within the scope of the accreditation 3 years ago. And now you've, in fact, it was perhaps a nascent line of business and you weren't sure you needed to be accredited. And then in the interim, you've decided it's going to be accredited. If you just pull that in to the scope of the accreditation, you may have policies and procedures that were developed for a line of business that was not within the scope of the accreditation 3 years ago, and now you've decided it is, and somebody forgot to say, wait a minute, we got to make sure those policies are compliant with URAC accreditation, even though they didn't need to be 3 years ago. So any dramatic change in the organizational structure or personnel can cause this to happen.
Awesome. Thank you so much. Are we ready for reason number 3? All right. The third reason that we see accreditation loss happening more often these days is that staff fail to consistently implement the compliant processes, and that failure went undetected.
Audit, audit, audit. Having a process to ensure that you are staying in compliance with the standard. Core 3 says that you must have policies and that you must comply with them. And that's a mandatory element. So you want to make sure that you stay on the right side of compliance as it relates to following your policies and procedures.
And, I empathize with those who are running the accreditation program and trying to keep everybody in line, because everybody's on board the year that you're going for it. But when you have to maintain it for the next 2 years, it is really hard to get buy-in from those who are participating with it. And all I can say is that it's a very expensive process. And it's important that from the top down that everybody buys in to stay on goal for reviewing those policies, procedures, getting the reports and metrics in, and making sure that you're moving the train along so that you're not scrambling 3 years later.
This happens a lot in the quality management area, but elsewhere as well, where there are certain things that the quality management committee simply has to do. And so first, make sure it meets quarterly. And second, make sure that the QMC continues to do what it's supposed to do every single quarter and every year. A very often missed requirement is perhaps one of the performance metrics that you're supposed to be tracking. You just stop tracking for a while. You're supposed to track, for most of the URAC accreditation programs, satisfaction, complaints, and access, and one of those might fall off the table. Your QMC might forget to do an annual evaluation of the effectiveness of the quality program. And as Sue said, audit, either internally or have somebody come in and externally audit to keep you on track.
Thank you so much. Moving right along to the fourth common reason we are seeing for accreditation loss: committee failures. Either a committee didn't meet with the required frequency or it didn't do what it was supposed to do at those meetings.
So I think this really runs on the last thing that we were talking about. And we're hoping that the quality improvement projects that everybody's working on and metrics that we're collecting are meaningful, and that we're not just doing it to meet a URAC standard, that we're doing it to find how we can improve satisfaction and how we can improve our business. And so it'll be really important to make sure that your committees are meeting not just quality, but your compliance committee that your compliance committee is hand in hand with your quality committee to make sure that you can demonstrate, as Sue said earlier, audit, your compliance with your own regulations. So hopefully, in this continual quest for satisfaction, it's leading you through quality and through compliance and your other requirements that you have to do to meet as a committee.
Yeah, I think I probably answered two questions at once with the last one. They do kind of happen together sometimes. So it's, and it's not just quality. It could be credentialing. Credentialing has its own. I mean, for example, we one client we know of kind of looked away from they kind of changed their policy and procedure approval process across the board. And in doing that, they took away the regular reporting or running of credentialing policies to the credentialing committee. Easy to happen. Oh, yeah, because the Core 3 requirement of you got to have all your policies and procedures reviewed and approved each year doesn't say how or when. So it would be easy to see how you could, someone rewriting that policy say, well, it doesn't say we have to take it to the credentialing committee. Let's take it to the quality committee or to this committee over there. But there's a subset of the policies and procedures for a health plan or a health network that must go to the credentialing committee. And so that's actually both the third and the fourth issue there. Somebody changed the process and thought a little bit about how it would impact URAC compliance, but didn't, and it complied with Core 3, but not with the credentialing standard that requires the credentialing committee to be involved.
And for all of you folks who are accredited for specialty pharmacy, the clinical oversight committee standards are really important. That talks about evaluating your patient management program on an annual basis. It requires both subjective and objective data. So you want to pay attention to the clinical oversight committee for those specialty pharmacies to make sure that they're meeting as your policy dictates.
Thank you, Sue. It occurs to me that the other committee that struggles with this might be compliance. In that I think we've seen a number of clients who maybe somebody new comes in for compliance and they keep up with tracking compliance with the laws they know about, but not necessarily monitoring for new laws and regulations.
Right.
That's something I've heard you three talk about a number of times.
Sure.
Well, and the other piece of compliance is ensuring that things like your licensure is up to date. I can speak to two real life experiences where, as a reviewer, I went out to check a state license, and I found that their license had been not denied, but suspended, and it had been 6 months, and they didn't know it.
Mm.
So making sure that there are those kind of mechanisms. Sometimes you use organizations to help you stay on track of what, if you're an organization that has accreditation, has licenses in multiple states. So you're a national company and you're required to have, 30 different licenses. Some organizations will use an organization to help them stay on track. And we have seen organizations that have run afoul of their accreditation compliance because, for whatever reason, the organization missed a state. And therefore, when URAC becomes aware that you're not licensed in one of the states that you say that you are, that's another key component to compliance that you need to stay on top of. And
back to your point, Sue, about auditing. I mean, this is auditing your delegated contractors, whether they're within the scope of the URAC accreditation or not. Audit your delegated contractors.
All right. And final reason that we are seeing lately for accreditation loss is a failure to report significant organizational changes to URAC in a timely manner. And others don't know about this requirement. Let's tell them.
Well, it's outside of the standards. It's in your contract with URAC. It's in what's called the AA, the Accreditation Agreement, and right in there it says anytime, and it defines what a significant organizational change is. And you would be surprised at how broad that definition is. More things than you know, I suspect, are included within the scope of that provision that requires that you report it. A more obvious one is an acquisition or a merger, but significant change of certain senior executives in your organization. What else? Sue and
a
Lesley,
change of address.
Oh, yeah.
Moving from one state to another results in may result in a potential organizational change on site, where they come on site to make sure that you're following the same policies and procedures. Things like a new medical director, if you decide to delegate a function, either to, if you send it offshore, there's requirements for you to submit that change prior to that delegation occurring if it's being done offshore. Any other org change is typically 30 days. If you have, if a state or federal organization comes in and does some type of investigation and you've not made notification, that could result in you not in you losing your accreditation. The other big one, indirectly related to your agreement, is failure to report measures. You can lose your accreditation if you don't report your measures, if there's measures tied to your accreditation program.
Ashley, Sue, can you talk about that for a little bit? It's such a good point, and people always are asking us, when do we need to start reporting our measures? Sure.
So typically what happens if an organization is getting accredited and there are measures associated with their program, let's say giving an example of a timeline will make it clearer to you. So anytime in 2018, if you become accredited, January 1st of 2019, you have to start collecting the data. You reported in 2020, and then every year thereafter. I believe it's October 1st. The last time I checked URAC's website for their FAQs related to measures, every October 1st, URAC will release some specifics to the measures for you to be aware of for the next calendar year. And there are different reporting requirements. For instance, if you are a pharma applicant, you have to have your data gathering process validated by an outside entity. So there's those budgetary requirements that you have to think of as you're preparing to do measures.
And then there's a lot of people who are on from different modules. Do all modules require reporting? I don't want to start a panic for those who...
No, it's very defined. I think as far as I can remember off the top of my head, case management has measures, health plan has measures, the pharma standards, specialty mail, DTM, PBM, all have measures associated with them. And a marketplace has measures associated with them.
Thank you. Any other thoughts on that?
I don't think so.
All right, well, with that, we'll move on to questions. We have a couple that have come in while you've been speaking and a few that have been voted up. So I'm just going to go for the ones with the most votes. So for those of you in the audience, if there's a question on the list you'd like answered, please vote it up to the top. The first question on our list is, what software program is most commonly used to assist with ongoing compliance maintenance?
Tom, you want to take that one?
Say that again, Sana. Sorry.
What software program is most commonly used to assist with ongoing compliance maintenance?
Well, I'll say briefly ours. We developed a few years ago a piece of software called Goldfinch that is now, we used it primarily to interface with our clients during the actual accreditation and reaccreditation process. But since we've launched our ongoing compliance maintenance program last year, our clients are now using that. And other software that we've come across, Compliance 360, we've come across a lot. It is, for some of our clients, more ornate and difficult to learn than their organizations could tolerate. But it's a very robust, for some organizations, a very robust and perfectly appropriate, good kind of tracking software. Before Goldfinch, we used spreadsheets, and it was as painful as it was a whole lot better than nothing.
So I think, if you're going from multiple accreditations, right, historically there was 360, Compliance 360, and it's been very interesting to us to develop our Goldfinch, and we are spending some time looking into what we can do to make it even better for future use for both multiple accreditations and for ongoing compliance.
Awesome.
Yeah, I think that's good.
Right.
We developed it primarily as this interface during the accreditation process, and hadn't even invented our ongoing compliance maintenance service yet. And now that we have, we're looking at Goldfinch, and we're going to be implementing throughout the next quarter or two some upgrades that will help it be an even better piece of software. We've used it very effectively with our ongoing compliance maintenance clients in the last year, but we've seen some opportunities to improve it, and hope we'll have those implemented within this quarter, actually.
Yes, it's all very exciting, so stay tuned. All right, our next question has 5 votes for it. Suggestions on keeping up with state and federal regulations.
I'll lead out, and I know Sue and Lesley likely have some comments here. That for me, this is exactly like what I faced in 1994, when all of a sudden, for the first time in my life, I was a general counsel of a large health plan that operated in multiple jurisdictions. And I walked in and said, now that I have the job of making sure we don't break the law, I asked my staff, what are the laws we're not supposed to break? And they kind of pointed at a shelf of law books. They said, well, right over there, there's the Maryland Code. I said, no, we need something much better than that. Because what became really immediately clear to me, and this is reflected in URAC's interpretation of its compliance standards, Core 4 and PCP1, is there are really 2 pieces to tracking the laws and regulations that apply to you. First of all, you've got to get your arms around the laws and regulations, both state and federal, that apply to you today. What are those? And that would be HIPAA. That would be, if you're a specialty pharmacy, the pharmacy licensing laws. It's both the kind of general healthcare laws that apply to everybody, fraud, waste, and abuse, and so on, and those that apply to your organization today, based on what you do, whether you're a specialty pharmacy or health plan or case management organization and so on. But that's only half the issue. The other half of the issue is tracking the changes in those laws. And so it's really 2 rather distinct kinds of tracking mechanisms. You've got to build a database, whether it's in a spreadsheet or something like Goldfinch, piece of software like Goldfinch, or some sort of software to keep track of that existing database. I mean, it was so overwhelming to me as a first-time general counsel. I just had my associate general counsel do that for about 2 months. I literally list every law that applies to us and what the ramifications are of that on our behavior as a health plan. But then you've got to keep your eye on how do you know how that changes. It could be involvement in a trade association's legislative committee. It could be receiving newsletters either from a trade association or from a regulator or both. CMS, for example, Center for Medicare and Medicaid Services, puts out regular bulletins to certain entities, and you kind of make sure you get on and read that list. And so it's going to vary depending on the kind of organization you are and where you operate, and the organizations that, and both private and public, that are associated with your line of business. And then you've got to have a system for when you do see a change, making sure that something happens to that. I used to work in a subsidiary health plan of a very large national healthcare organization, and I would get these bulletins from the parent organization's legal office. And it took a while for me to figure out that I was supposed to actually, oh, right, I need to actually make sure that operations knows about this change. I need to, and then, well, how do we track that? And then set up a software solution to tracking any kind of information that comes in from any source about changes that were made at the regulatory or legal or legislative level.
So if I can summarize, you need to track it, you need to evaluate your current compliance with it, and then you need to disseminate that information down to those whose jobs are going to be affected by it.
And then circle back around to make sure that they implemented what you told them to implement.
But yes, the evaluation. And then sometimes you'll also find that your client has certain requirements. Your client could be the government, your client could be a carrier. If you're, it just depends on your line of business. So you're going to need to have an open communication with your clients as well. Sue, I'm sorry.
And that's all right. I'm sorry. I thought you were done speaking. One of the other strategies that I've seen organizations use is to track when a state regulatory body is in session, because then they can track when potential laws are coming up. They'll get a preview, and then once it's passed, some organizations contract with healthcare attorneys that keep track of that information. Some organizations have LexisNexis. There are a lot of strategies that I've seen used throughout my years as a reviewer. And, just having that mechanism well defined. And as both Tom and Lesley spoke about, what is that mechanism to evaluate whether that particular change in the regulation has an impact on your organization is key. Because you need to get subject matter experts at the table from different departments, interdepartmental meetings, because you may not be aware of how that may impact the department or the claims department. And so having those subject matter experts hearing about the requirements and then them having an aha moment and saying, hey, that impacts us in a big way.
And Lesley, you alluded to another source of compliance when you mentioned your company's clients' requirements. This is particularly compelling if your client is the government. If, let's say, you're a Medicaid health plan, or if you're in the TRICARE system as either a health network or a health plan. A TRICARE contractor health network doesn't really have much law to deal with. Almost everything that a TRICARE health network has to deal with is in the administrative manual. And that's being changed, we are told by our TRICARE clients, every single month. So you got to make sure that you're watching all of those bulletins and then taking that to your implementation committee meeting and saying, all right, TRICARE's done it again, here's the new requirement, and then audit that requirement's been implemented in your organization. In our organization, we take a comprehensive approach to contracts, laws, regulations, and accreditation standards, so that we're tracking everything in Goldfinch, including contractual requirements like liability insurance requirements. We're putting in the Goldfinch so that we don't think of accreditation and law and regulation and contracts as a separate thing. And that's really starting to, and we're just implementing this now, and we're really starting to get a sense that kind of unified field of compliance helps the whole organization to see really the broad array of external requirements as one thing.
Thank you. Anything else on that?
That was a good question.
All right. Well, let's move right along to the next. With 3 votes, how often does URAC conduct mock monitoring on-site reviews, and how do they work?
So I'm going to start this one off soon, and then I'll send it to you. But
Okay.
they hold a lottery, and if you win the lottery, you get to have an on-site monitoring. And so a certain percentage every year, and you might get the monitoring on-site 6 months after you got your accreditation or 6 months before. Sue, I'll let you fill in those details.
Sure. Okay, so every year URAC budgets to do a certain number of mock monitoring, of monitoring on site, nothing mock about it. And you get notice 3 to 5 days. They may have changed that policy since I've left URAC, but that typically was the notice that you would get. Typically the dates don't change. You can't change the dates for a monitoring on site. I hear that they've been doing more of them virtually than actually on site. And they will look at things like document review. There's no interviews that go on, so it's mostly file review that they're validating. There's a large majority of them that are mandatory standards. And as Lesley indicated, they just select a certain percentage and you get the notice and then they show up. And how they work is they will, it's usually one reviewer that comes, either does it virtually or comes on site. And they will then take those results. And if you need an action plan, they'll ask you for an action plan. If they find egregious issues, they may take your application back to the accreditation committee for a discussion and decision. That doesn't happen very often. Usually it's more action plans to come into compliance.
So for those of you who are ACHC, it's not the same day. They don't ring the doorbell and say, we're here for your review. They do give you a little bit of notice. I'd say 2 business days. Is that what it is, Sue?
I think so.
But what's great about it, especially, I love when it actually happens a year or 6 months before the next accreditation, because it gives you a really good heads up for what to fix before they come back on site.
And it also kind of wakes the organization up. Oh my God, accreditation. I do believe it's
right.
I do believe it's true to say that Sue and I were on the very first monitoring on-site review that URAC ever conducted. That's true. Before the program had been established, URAC decided, well, we need to take a look at that organization. And we called the same morning from National Airport to let them know we were on the way. I wanted to rappel down the side of the building and break through the window, but they wouldn't let me do that.
And typically, in my experience, the monitoring on sites were done in the middle year of your accreditation cycle. But Lesley's right. It can be 6 months after you get your accreditation. Typically, it's not done 6 months at the end of your accreditation in the last 6 months, because you're already preparing for your reaccreditation visit. So it's typically in that middle year that they do.
And there's one other thing I want to say about a monitoring on-site review is to be distinguished from a for-cause review. They're the same in the sense they both can happen anytime in the 3-year period, but the for-cause is in response to a complaint. Either a consumer or a provider will phone in a complaint, and the process goes through much the same, a very similar process. They'll let you know they're coming on site. They come on site, do a review, or they don't let you know.
No, they do not let you know. If it's a for cause on site, they'll call you the morning of at 8 o'clock and say, hey, we'll be there at 9.
Oh, okay.
Now, unless something's changed in the last few years, but that's been my experience.
And then they can, in either case, if there are issues that concern them, they could come back. They could kind of dig around some more. They can ask for documentation. It's a pretty dramatic process to go through. One of the other differences between the two is the appeal process is a little bit different for the two. those are technical details that hopefully you won't have to worry about.
Here's hoping. All right, our next question, also with 3 votes. Discuss the best way to prove primary source verification. Screenshot of page of documentation of date, site, and checker.
Okay, Les.
So, primary source
It's all Lesley.
For licensure, for example. So in your application, there are 2 areas where you can submit primary source verification of licensure. It may have to do with the showing that you have licensure for your senior clinical person or for their board certification. And doing a screenshot, as long as it shows the date and has within it the expiration of the license or board certification, will work. In an actual credentialing file, same thing. They're looking for, you might be showing them an electronic version or a print off of the report that you received. It needs to have the date that it was verified and the expiration date of the actual licensure or board certification. There's one standard I might as well touch upon, which is CR9B, and that has to do with a credentialing standard in both network and in health plan. Now, it requires that you're going to primary source verify board certification or the highest level of education. If it is a type of provider that it only has a education, no board certification, then you would only need to verify that the one time for initial credentialing. You don't need to re-verify it for re-credentialing, but for your on-site reviews, you need to be able to archive it and show that it was once done. So you need to be able to always attach it into your credentialing file, never shred it, give it away, don't archive it forever. Make sure that if you are archiving it, you're reattaching it to always show that you initially did that education. Anything to add?
I would just, and you may have said it and I may have missed it, making sure that whatever printout you have, make sure that it shows the site that you went out to visit. So for instance, if it was the state of Pennsylvania, you could see that it was a PA nursing license that was verified through the
state. And if God forbid a Katrina happens and there is no state website and you're doing it by telephone, just make sure that you have who verified it for you, the information, the credentials itself. So you'd want to know the expiration date, whether the license was in good standing, and who you are that verified it on what date.
And where you checked, right?
Yeah, with whom?
Yep.
Perfect, thank you. All right, next up with 2. Question is, any new standards not in URAC 3.0? And I think this is referring to Core 3.0.
Yeah, this is an interesting subject. The answer is yes, no, and maybe. So yes, there are new steps. So URAC rolled out Core 4.0 in February of this year, and then published every few weeks a rollout schedule as to when Core 4.0 would become relevant to each of the URAC accreditation programs that use Core at all. And the first one that it rolled out, Core 4.0 to, was case management. And so that's the yes. Case management has radically new standards, both on the case management side and the Core side. So that's brand new. This is version 6.0, Sue, is that right?
Yes.
Yeah, so case management 6.0 has the new Core standards. And then URAC also rolled out, just after that, the Certificate of Organizational Management, COM we call it. This is basically what URAC has done to replace its old Core-only accreditation program. It used to be that ever since Core was invented more than a dozen years ago, more like 15 years ago, that if your organization didn't have an accreditation program that described its business, like if you're not a case management or a UM or disease, any of those that URAC has, but you still wanted to be accredited, you could go to URAC and say, I want to be Core only accredited, and then you could select those portions within the 40 Core standards that apply to your organization, and go through the accreditation process for that. So that's been going on for years, for generally for vendors of URAC accredited companies who are delegating activities to them or functions to them. Well, URAC has replaced the core only program with the Certificate of Organizational Management, effective in February. Now, so those are the two yeses. Just 10 days ago, maybe 12 days ago, URAC rolled out a new notification that said, well, we're going to put everything else on hold. The rest of the Core 4.0 rollout is on hold. Apparently, the organization, URAC, has been getting a little bit of pushback, maybe more than a little bit of pushback from certain sectors of the accredited world. And to address those concerns, URAC said, well, all right, we've got this beta test of case management and COM. Why don't we just see how the new Core 4.0 standards roll out? Oh, I should tell you, COM is just a subset of the core standards, Core 4.0. It's most of the Core 4.0 standards, but not all of them. So URAC said, why don't we just use this as a laboratory, case management and COM, see how that rolls out, and then once the organizations that are going through that now in 2018 and early 2019 get feedback from them, kind of like a beta test program, go back into the Core 4.0 standards, make any revisions that need to be made, roll it out again, and then roll it out to the accreditation programs that use core, health plan, especially pharmacy, all the pharmacy programs and all the medical management programs other than case management. So that's the no. And now here's the soon, or the maybe. There's one exception to this. In its missive of not quite 2 weeks ago, URAC said we are going to modify the delegation standards. Currently, the delegation standards in core 6 through 9, they are going to be replaced by a new core 6. Really, as soon as URAC can do all of the things that are required in terms of developing the publications, and it could be anywhere from a few weeks to maybe a couple of 3 months. So we'll just keep our eye on that and let you all know by the same mechanism that you found out about this webinar. But all 4 of those standards will be replaced by a new Core 6, which resembles which is the delegation standard in Core 4.0. URAC is anxious to get that out, and they apparently haven't received the same kind of pushback about the consolidation of these standards. And frankly, it's a simplification of the process. The Core 4.0 delegation standards don't have all of the various components to the delegation contract and so on in the same way. So it's a simpler, more straightforward approach to delegation. That'll come out probably this fall. And will apply to any organization that submits its application after URAC makes that change. That will become Core 3.1 and Farm Core 3.2.
And I'll say that we've been studying the Core 4.0 and the new standards that came out for a while now. We found that there are some brand new sections. There are some things, like Tom said, for delegation that have been made a little less stringent. There's fewer things that you have to meet. And then there are a lot of standards that stayed exactly the same. And we started to get ready to blog and get ready to have this forum for them in the near future. But with the new announcement that they're really going to beta test the current standards that are out there, we don't want to spin wheels, and we don't want you to spin wheels either. So we're going to see what happens, and I think we'll have an answer fairly soon.
Yes, so you can all take a nice deep breath and let that Core 4 anxiety wait until next year sometime.
Right.
Unless you're case management or Certificate of Organizational Management.
In which case, call us. All right, our next question. If you are assessing your program on a quarterly basis and monitoring performance, does URAC expect to see an annual report separately from the quarterly documentation?
Yes, they do. So you're having your quarterly meetings and you're talking about them, and what you discuss in quarter 1 might be very different from what you discuss in quarter 4. And it's important to take a step back and take a look for any trends, any time. So should we retire something now and start something new? What did we learn from all the metrics that we collected? Is there opportunities to improve our satisfaction? Did we identify an issue? So it's really important to take that step back, take a look at it. And in quality management, you actually have to take it from the quality management committee and send it to a committee that oversees quality management for their assessment and evaluation too.
Perfect, thank you. And the next question is, what type of services does your organization provide annually to help organizations stay in compliance and avoid denial of accreditations?
Well, here I am psychic, so I can predict that a green button will appear at the bottom of your screen, which will, if you click it, will take you to a page that describes all of them. But I'll give you a high-level overview orally. First of all, we sit down with you and say, all right, who in your organization does this required thing? And who and what committees do these required things? So we map out on an individual basis what your monthly, quarterly, and annual requirements are, and that's usually based on the accreditation requirements, and based on the and we find out who in your organization handles this, who's the chairman of that committee, who's the point person on those issues, and then we set up a series of notifications that come out monthly that remind you. Don't forget this is the month that your quality committee has to do X, Y, and Z. Don't forget this is when we agreed in our meeting that you need to do this thing. So that's the first thing. We customize a set of reminders to make sure that everybody stays on track throughout every month of the year. And then we do quarterly reviews. 2 reviews a year, 3 reviews a year are virtual, and 1 is on site. 1 each quarter we do a review. So let's say you got accredited in January of this year. We would do virtual reviews the 2nd, 3rd, and 4th quarter, and then an on-site review in the 1st quarter of next year. And then, and this is kind of presumption that we can move it to accommodate your particular needs, but this is our kind of our template approach. And then we would do virtual file reviews or interviews the 2nd, 3rd, and 4th quarter, and then another on-site review in the 1st quarter of 2020. So we and the reviews we design the reviews to address both what we think are the likely pain points or problem areas and issues that you may raise. So we'll contact a client whom we owe a quarterly review at the beginning of the quarter. Of course, we're in the middle of that right now at the beginning of the 3rd quarter. And we'll say, look, you've got a virtual review. What do you want to focus on this month or this quarter? And they might say, well, it's a credentialing. We've got some real concerns about some organizational changes over in credentialing. Or, you know what, last quarter we encountered, Sue uncovered some stuff in our medical management processes, and we'd like to see if we've implemented the fixes to those. And so we will adapt our quarterly virtual or on-site reviews to both what we think are the needs and what your organization think are the needs. What have I left out, Sana?
I think that mostly covers it, except for anyone who contracts with us for ongoing compliance does have the option of a number of add-on services that are billed hourly. So if, say, you do your quarterly reviews and you realize you need a much deeper dive, or you need someone to come on site and help implement something, or you need some additional training, all of that is available as part of the package.
Good point. Good point. Thank you.
I'd also say that Sue developed the most beautiful dashboard to help people keep on track for quality. It is tier worthy. And she has worked really hard in both quality and case and in the patient management area, where most of our folks really need a lot of help to maintain. Sue, do you want to talk?
Yeah, and one other thing, let me add this, and then Sue, bounce it to you if you have anything to add, is one of the services that all of our ongoing compliance maintenance clients get from us is a license to continue to use Goldfinch. So you can use Goldfinch as a as an ongoing way of maintaining your accreditation and otherwise compliance world. And so even if you're done with your accreditation process.
I have nothing to add. Thank you.
And I just want to call out Sue's getting some love for that quality dashboard over on the chat bar on the side. It really is an incredible tool. All right, well, I think we probably have time for one last question. And we have a couple left here with votes. So right at the top of my list is there a good approach to combining multiple accreditation programs?
Let me frame this so that we answer both. Actually, there are two questions implied here. I can hear three questions implied here. It can be, let's start with, what if you have multiple accreditation programs with the same accreditation organization? Not uncommon at all. You've got a health plan that also has a disease management program or a health call center. Built into URAC is the overlapping. The same core, if you're going through at the same time, the same core will be used. So you'll be able to coordinate that. And so then it becomes one great big accreditation program effort. Now, a subset of that is, what if you're on two different schedules? This happened to a regular client of ours many, many moons ago, where they had, in 1 year their health plan was up, and then the next year their disease management was up, and it was making them crazy because they were always in a state of reaccreditation, which can be bad for the stresses. So they went to URAC and said, we want to get these all on the same schedule. And URAC was accommodating for that. And Sue, I think you were in leadership back when the health plan I was thinking of did this about 15 years ago. So that's another another realm. But then you've got the situation where, particularly in the pharmacy world, a number of payers, PBMs and otherwise, are requiring their pharmacies to have multiple accreditations from multiple accreditation organizations. They might say URAC plus somebody else, or URAC plus ACHC. And in that situation, the obvious answer is to make sure that you comply with the more rigorous of the standards that are on the same subject. You might find that a particular ACHC standard is not quite as high a bar as the URAC standard, and then you need to kind of make sure that you're going with this one and not this one. And this will happen particularly as you broaden your compliance tracking mechanism, as we talked about earlier, as you start to say, well, everything is compliance, contracts and laws and accreditation programs. And what you'll start to find, as some of our clients have found, is that if you put everything in Goldfinch or a similar software, if there were such a thing, you can actually see the relationship between these standards and accommodate your policies accordingly. What did I leave out?
I think it also ties back to what we talked about at the beginning of this discussion, is by choosing that higher stringent standard, it'll help you make sure you're always meeting the mandatory standards. We were talking about how we got off track earlier when you changed up your policies and procedures. So as you choose the higher stringent standard, you need to make sure you're still auditing that policy and procedure to ensure it has all of the details from all of the accreditation organizations you want. So if, for example, NCQA requires a fellowship as your highest primary source verification, as opposed to URAC, a residency, well, if not everybody has fellowship, we still have to make sure we're keeping all the details as we go down for all the different types of accreditation that we are going to include in our policy and procedure to ensure that it's going to be compliant for all of the organizations that we apply for.
Excellent. Well, that does bring us to time. So thank you very much, everyone. We know your time is valuable, so we want to let you go on time. Shortly after we conclude here, a replay video will be available right here. And if you have any further questions, you're welcome to reach out, send us an email. If you have a topic you'd like to see us do a webinar on, go ahead and shoot us an email, let us know, or you can post it in the chat window here even after the event has ended. Thank you very much, and we hope you have an excellent rest of your day.
Take care, everybody.
Thank
Thanks
you.
for coming.
Bye-bye.